Hello, my name is Alison. I'm a physiotherapist. I'm going to give you some information to prepare you for your surgery at Murrayfield. You may like to share this information with your family or friends or anyone who's going to support you when you go home from hospital. Don't worry about taking notes. We will provide an information pack with all this information included for you. What is a knee replacement? So in the knee joint, the ends of the bone are normally covered with a smooth cartilage, but when you have arthritis, the health of this cartilage deteriorates, and this can result in pain, swelling and stiffness in the joint, can affect your ability to walk, sleep and do your activities of daily living. So during the surgery, the damaged surfaces are removed and replaced by artificial surfaces which are made of metal and plastic. There are two different types of knee replacement. There is a total knee replacement where both sides of the joint are replaced, and what we call a uni knee, which is just a half a knee replacement, so only usually the medial side, the inside of the joint is replaced. So a uni knee is only suitable for you if you just have arthritis in one compartment of the knee. So your surgeon will decide what's the best sort of knee replacement for you. So thinking what to bring with you into hospital. So you need to bring your medicines in with you, all the medicines that you take in the boxes that they come from the pharmacy in. You'll also need your sponge bag with your toiletries in, so toothbrush, toothpaste, flannel, any creams or sprays that you like to use. You'll need your night clothes to wear in bed, so a nightie is fine, but for gentlemen, rather than long pyjama bottoms, it's better to wear pyjama shorts so that we can get to your knee. You'll need daytime clothes because you won't be staying in bed. So loose, comfortable clothes, a dress or a skirt is fine, or shorts. They don't need to be anything fancy. Sport shorts or your holiday shorts are okay. You'll also need something to wear on your feet. Slippers are fine, but not battle slippers or mules, slippers that are secure on your feet, they're enclosed all the way around. You don't have to wear slippers if you're not a slippers person, you can wear shoes. Flat shoes or trainers, slip-on ones are very convenient actually, so you don't have to bend down to the laces. Also, if you use a walking aid, such as a walking stick or a particular type of frame, bring those in with you and we'll see if they're suitable for after the surgery. But don't worry if you don't have any, because we will provide the walking aids for you if necessary. So thinking how long you'll be in hospital, you come to hospital on the day of your surgery and you'll have your operation that same day. You'll need to stay overnight. Some people will be ready to go home towards tea time on the day after the operation. Some people may need to stay another night. So you will be in hospital 1 or possibly 2 nights after the surgery. So don't worry, we'll always make sure that you're able to get around your own home and that you're well before you're discharged. So it's normal to expect some pain after an operation, and when you have a knee replacement, the incision goes right over the front of your knee, so it is uncomfortable to bend your knee after the surgery. But it is very important that you get that knee going as soon as possible. So severe pain is not something you'll have to put up with. You will be prescribed some medication which will help with the pain. So you'll need to take it in hospital and also probably for a few weeks after you go home. We will also use ice packs. We use a special cuff called a cryo cuff, which helps to reduce pain and inflammation after the surgery. Thinking about other practical things that you can do to help reduce pain. The first thing is distraction, so something to take your mind off it. So you can bring in your mobile phone or an iPad, a book, your knitting, something that you can do to take your mind off just sitting thinking about your predicaments. As I mentioned before, we'll use the ice pack to reduce pain, and gentle movement and exercise can also help to relieve discomfort. So your surgeon may have mentioned to you that there can be some complications following surgery, and one that we always try and reduce the risk of is the risk of blood clots. So a blood clot or a deep vein thrombosis can form in the veins in the legs. The symptoms of that are pain, heat and swelling in the calf. If a blood clot breaks off, it can travel in the bloodstream to the lungs, where it would be called a pulmonary embolus. And the symptoms of that are breathlessness and chest pain. So don't worry, if you do get a blood clot, it can be treated, but by far the best way is to avoid them happening in the first place. So the main way of avoiding a blood clot is early mobilisation, to get up and around and moving as soon as possible after the surgery. So we'll be encouraging you to get out of bed as soon as possible and walk about. We'll also teach you some exercises to do in bed, which will help to improve the circulation to your legs. You'll also be prescribed some special compression stockings to wear, and you'll need to wear those for 6 weeks after the surgery. Drinking plenty of water increases the blood volume and again reduces the risk of blood clots. And finally, a special drug will be prescribed for you. You'll need to take that for 2 weeks after knee replacement, and again that reduces the risk of blood clots forming. So physiotherapy is very important after a knee replacement in order to get the best result from your surgery. If you aren't able to follow a physiotherapy program, there is a risk that you can end up with a stiff knee, which is something we definitely want to avoid. So we will send you out an exercise sheet that you can look at before you come in for your operation, and if you can, try and practice some of the exercises in advance. When you're here in the hospital, you'll be seen by one of our physiotherapy team, and they will go through the exercises with you and show you what to do. But we will expect you to do these exercises even when we're not with you. When you go home, we'll ask you to do the exercises little and often throughout the day, ideally doing them every couple of hours. And after each exercise session, we ask you to follow it with using the cryo cuff, the ice cuff, to keep the swelling down. You will need to follow the exercise program for at least 6 weeks after your knee replacement to get the best result from your surgery. So we're just going to demonstrate the exercises for you now. So first of all, the deep breathing exercises, breathing in through your nose and sighing out through your mouth. So we'll ask you to take 3 good deep breaths every hour while you're here in the hospital to get plenty of oxygen into your body. So now going on to the circulation exercises, pumping your feet up and down from the ankle. This causes the calf muscles to contract and relax and helps to pump the blood around your lower legs, reducing the risk of blood clots. Now going up to your knees, we're going to contract the big muscles on the front of your thighs, your quadriceps muscles. So pulling your toes up towards you, pushing the back of the knees down and squeezing the muscle, and then letting them relax. And again, toes up towards you, contract that thigh muscle and push down, and then let the muscle relax. So we ask you to do 10 contractions every hour. And this big muscle on the front of your thigh, your quadriceps muscle, is one of the most important muscles for the function of the knee. So very important to get that working well. Okay, going on now to the knee movement. We're going to ask you to slide your heel up to bend your hip and your knee and sliding down. So this looks easy now, but after the surgery, it will be quite difficult to do to begin with. So you can use your hands to help a little bit, sliding up and sliding down. And you're aiming to get your foot flat on the bed to get a 90-degree bend at the knee. Going on to the exercises in sitting now, so either sitting on a high surface with your feet off the floor or on a highish chair. I'm going to ask you to kick up to straighten your knee and then relax down. again, kick up to straighten your knee and lower down. So we're working your thigh muscle to kick up to straighten your knee. And again, we ask you to try and do 10 contractions. The next exercise is working to try and bend the knee. So sliding your heel back along the floor, trying to get your heel underneath the chair, and then sliding it forwards. And again, pulling back to bend the knee and forwards. And again, you're trying to get at least a right angle and 90-degree bend at the knee. So we're now going to demonstrate the walking technique. So when you first get up after the surgery, we'll use a Zimmer frame because it's very simple to use. So we're going to demonstrate that for you now. So when you're getting up, have your operated leg slightly in front, push up from the chair and put your hands on the frame. So when you're walking, we use the technique frame forwards first, short step with the operated leg, and then the good leg. Frame, operated leg and the good leg. Frame, operated leg and the good leg. So when you go home, we'll send you home from hospital probably walking with 2 sticks. We're going to demonstrate the technique now. So sticks forwards, operated leg between the sticks and then the good leg. So sticks, operated leg and the good leg. Sticks, operated leg and the good leg. So when you leave the hospital, we will have shown you how to get up and down the stairs. We have a little set of practice stairs for you to try on. So when you go home, you should be able to go upstairs to bed. You won't have to sleep downstairs. So we'll show you now the technique. You walk to the bottom of the stairs using your sticks. When you get to the bottom of the stairs, you need to take hold of the banister rail. So put both sticks into one hand and hold the rail in the other hand. So going up the stairs, you need to step up with your good leg, push up with the good leg, bring your operated leg up and the stick afterwards. And again, good leg first, bring the operated leg and the stick to follow. And again, good leg first and the operated leg and the stick. And we're nearly there, last one, up onto the landing, operated leg and the stick. So you've walked from your bedroom to the top of the stairs. When you get to the top of the stairs, you need to put the sticks into one hand and hold the banister rail with the other hand. So going down the stairs, you put the stick down first for a bit of support. You carefully lower down your operated leg and then join with the good leg. So stick down first, lower down the operated leg and join with the good leg. And again, stick first. Your good leg's doing all the work. And the last step, stick down, operated leg and the good leg, and then you're now ready to walk away. So thinking about practical things for home when you leave the hospital, you will need a chair to sit on which is easy to rise from. So not a really low, squashy chair, one that you'll be able to get up easily from. You'll also need a footstool, not a low stool, one that comes out the same height as the chair for you to raise your leg up on. If you don't have a high buffet, you could always use a coffee table to place your leg on. When you go home from hospital, it's important not to do too much standing and walking. So just pot around the house. I wouldn't go out for long walks initially. If you do too much standing and walking, you can get a lot of swelling in your leg. So the focus should be on the exercises to begin with. You're not allowed to drive for 6 weeks after a knee replacement, so you will be sort of staying more at home. When you go home, you probably will find it difficult to get into the bath. So the best thing to do is to use either a walk-in shower or just have an all-over wash in the bathroom to start with. In the house, if you can, take up any loose rugs or little knickknacks that you could possibly trip over with your sticks. And because you won't be able to go to the shops to begin with, it's a good idea to get plenty of shopping or ready meals sorted out in advance. If you can, ask family and friends to help with housework and laundry and cooking, because with walking with the sticks you don't have a free hand to do any of those tasks to start with. It's only a temporary measure. Obviously you're going to get better and better as the weeks go by. You will need a lift to go home from hospital and to bring you for any appointments. We will probably ask you to come in for a physiotherapy appointment about 2 weeks post-op, so you will need a lift. You won't be able to drive at that stage. If you do live alone, we do recommend, if you can, to have someone come and stay with you, just to help out for a few days. So thank you very much for listening to this presentation, and I hope the information has been helpful for you. If you do have any questions, don't hesitate to contact us here in physiotherapy, and we'll try and help you. So we'll look forward to seeing you here in Murrayfield when you come for your surgery.
Hello, my name is Annelies. I'm one of the pharmacists working here at Spire, and I'm just going to spend a couple of minutes talking to you about your medication and what to expect regarding pain relief while you're in here. So first I want to say that we look at pain in a very individual way. So we will address your pain the best we can, because once your pain is controlled, that's the thing that will ultimately help you to do your physio and your exercise, and that's the thing really that gets you back on your own feet again. So while in here, we follow the World Health Organization's pain ladder, and really all that means is we look at pain in a stepwise approach. So from that, step 1 is paracetamol. So paracetamol is a drug that so many people say it doesn't work, but it is a drug that is opiate sparing. So if you take paracetamol regular, so that means 2 tablets every 6 hours for the couple of weeks after your surgery, it will help that you need less of the more potent drugs that's prescribed. So saying that, so that's step 1. Step 2 is the drugs called the weak opiates. And in this drug category falls drugs named such as dihydrocodeine, codeine phosphate, tramadol, and nifopam. So you'll prescribe one of these drugs alongside paracetamol. We'll see which one works best for you, and that will be taken alongside paracetamol. That's where the variety comes in. Some people don't tolerate certain drugs for some reason, so we want you to speak up if something is not working, which will enable the nurses and the doctors to change it, because we want to send you home on drugs that we know is working for you and is controlling your pain. If none of that works in step 1 and step 2, we can step or ultimate upward to step 3, which is the more potent morphine-based products. But like I say, it's individual, it's what works for you, and then the idea is that we'll get your pain under control and then step down to step 2 and then step down to step 1 again ultimately, and get you eventually pain-free. All this will be explained to you while you're in here, and we'll make sure that you know exactly what and how you take your medication before you go home. So when we send you home, we'll send you home on this connection of drugs that works for you. We'll send you home with about 2 weeks worth of medication, enough to keep you going. You will unfortunately have to order some more from your GP once you get discharged, but we'll give you all the instructions how to do that as well. We will give you plenty of laxatives to take alongside this medication, because many of you know that these opiates and all the drugs that are morphine based cause constipation, and we'll just explain to you to take that alongside your pain relief to prevent any problems constipation wise going forward. Then lastly, we will give you a drug called a blood thinner, and that varies from consultant to consultant, and that's prescribed prophylactic to prevent deep vein thrombosis and pulmonary embolisms, and we'll give you the directions and how long you have to take that after your surgery. But we will see you on the ward. We'll look at all your medications to make sure it doesn't interact with them, and we'll be around to answer all of your questions.